Namaskar, hello and a very warm welcome viewers. You're watching Corona Samvad with your host Kriti Mishra. And on today's show, we have a very special guest joining us through virtual platform from South Africa, Dr. Angelique Coetzee, Chair of South African Medical Association. She was the first doctor to have reported the Omicron variant on November 18, 2021. Subsequently, on November 26, 2021, the World Health Organization declared Omicron as a variant of concern. Since the detection of the first case, there has been plenty of discussion and some studies over Omicron's transmissibility, symptoms and the rate of hospitalization. Even as media reports on COVID-19 abound with the focus on the present on Omicron, there is also a problem of misinformation and confusion over this variant. Let's get all the answers to all our queries from Dr. Coetzee. Madam, welcome to Sansad TV and thank you so much for joining us.
Good morning, and thank you for asking me. I'm not sure whether I can give you all the questions, but I can all the answers. But maybe I can answer some of the questions.
Fantastic, ma'am. Let's begin. Dr. Coetzee, I was reading that you saw 7 patients with similar symptoms of headache, fatigue, who tested positive for COVID-19 with rapid tests. With this new variant, the majority of the symptoms are mild. So, what really caught your attention? What made you sense that something was different? And how did you treat that?
So, good question. You have to understand that we have a different healthcare system in South Africa. We have a healthcare system where patients first come to the general practitioners and to access healthcare. We don't go straight to specialists or to hospitals. So what happened is during Delta, we saw a lot, or I saw a lot of Delta patients, so I know the symptoms out of my head. And then we had about a 2 months plus period where we didn't really see any new cases anymore. So we were between the 2 waves. We were expecting, however, the end of December or middle of December, our 4th wave. So on that day in November, when I all of a sudden saw this complaints and it didn't fit in with Delta, and I decided to test them, and subsequently found that they test positive. That was the beginning of the clinical picture that emerged within the next following 5-6 days of patients then having this new variant. We also in our Lancet laboratories also found that there's not a S spike on the PCR test. Is only 2 spikes instead of 3 spikes. And while our scientists were working in the background trying to find out what is currently happening here, we were still seeing the patient. And from a clinical perspective, we had tried then to figure out how bad is this variant, what is the predominantly clinical pictures that patients will present, how do we treat them, would they access ICU, would they need to go to ICU. So from a clinical point, we had to figure that out while the scientists on the scientifically in the background try to do the genome testing and the sequencing. And so this is how the 2 pictures comes together.
All right, you're talking about the clinical symptoms. We understand that in mild disease cases, there is no difference between clinical symptoms of the vaccinated versus the unvaccinated patients, although the vaccinated patients experience the intensity of their symptoms that is far less. How effective are vaccines in protecting against Omicron? Because again, there is a lot of misinformation on this one as well, ma'am.
Very good question, and I think we need to be open and honest and transparent around this. So your vaccines will protect you between around about 30% against mild disease. In our case, we are using Johnson & Johnson and Pfizer. However, we have seen that these vaccines protect you against severely ill disease or hospital admission. And with hospital admission, we mean ICU and intensive care units and high care units. So for mild disease, not much. However, for severe disease, yes, definitely.
All right, ma'am, this one is a difficult question to answer, but I'm intrigued to know, can the Omicron variant again mutate and change its character?
So I think it's important to understand that Delta didn't mutate to Omicron and Beta didn't mutate to Delta. So it's 4 distinct variants. So if there's a new variant coming, then that variant will mutate on its own. It will not be Omicron mutating to another variant. I hope this makes sense.
All right, yes, it does. But then there are also apprehensions about herd immunity. Do you think that Omicron wave will enable herd immunity?
Well, I think, yes, there will be, because a lot of people will be infected with Omicron, with mild disease, without even them knowing that they, that they suffer from the mild disease. So I really think there would be herd immunity. But we have now seen, it's not to say that the herd immunity is going to protect us against mild disease, as we have seen with Omicron, as we have seen in Israel with all these booster vaccines, they were still getting mild disease. So I think we need to understand that you cannot vaccinate yourself out of a pandemic. There must be public health measurements also in place, and the variants. It's going to depend on what's going to happen going forward. South Africa, we have clear data now showing that between the 4 waves that we so far had, there's a 3-month period in between where we have very, very low numbers, and we are actually in between waves. So if we look at that data, we do, however, expect our 5th wave around May, if it follows the previous trajectories of the previous 4 waves.
But ma'am, several experts are also of the opinion that COVID is heading towards an end with the advent of Omicron, which is now comparatively a weaker variant of the coronavirus. What are your thoughts on that?
So you were a bit unclear? Just repeat the question.
Yeah, I'll say that again. Several experts are of the opinion that COVID is heading towards an end with the advent of Omicron, which is now a comparatively weaker variant of the coronavirus. What are your thoughts on that?
For now, this is a weaker variant in terms of severity of disease. Remember, it still gives severe disease. There's still people who's extremely sick and ill in the ICUs, but the majority is getting mild disease. However, this is a fast-spreading virus. So a new variant should be to outlive Omicron. It should be more fast-spreading, or it should be more severe, or it can be a combination of more fast-spreading and more severe. We don't know. There's no one in the whole world that can predict what is going to happen within the next 6 months. We would love to say that it's become endemic, but it's too early. We still can't say that. And I think looking at the data, especially in the smaller countries like in South Africa, if we don't see a 5th wave around about April, May, June, July, August, and then we can say it's not following the same pattern as the previous 4 variants. So then hopefully we can then say maybe it's going to become endemic. But not until for the next 6 months, we will have to wait and see what the data is going to do and what the variant, if there's a new variant, how it's going to behave.
All right, ma'am, let's talk about another worry, which is, of course, about our children. How will COVID impact our children? Although the Omicron surge has not hit the children hard till now, at least, there are concerns over long-term consequences of COVID in children, especially a condition called multi-system inflammatory syndrome, which can affect the vital organs. How much does that worry you?
Good question. The data that we have in South Africa with Omicron, it's not really of concern to us at this stage. We haven't seen children getting extremely ill with Omicron. The children that we have seen so far, mostly very mild disease. Yes, they will present with at primary healthcare level with bit of a sore throat, a temperature, but about within 5 days, they're much better. They're running around as if they never have been ill before. So if you look at the average child, they should not get that. However, there's always children who are suffering from chronic diseases or immune compromised diseases. Those children are a different category. But even in them, we haven't in South Africa really saw children that much affected. With your Delta, the children are more sick than what we are now seeing with Omicron.
All right, ma'am, you're talking about the South African experience. In South Africa, where Omicron was first reported and then became the dominant variant, there has been a sustained decrease in reported cases since the peak was reported in mid-December 2021. What are the lessons for India from the South African experience?
So I think the lessons that one needs to learn from this, again, is you need to be open, you need to be transparent, you need to take the people on the journey so that they understand symptoms, that they understand when to access healthcare. And we need to make sure people get at least a first dosage, or completed dosage. We have also seen it doesn't help. You only had one shot and you still need your second shot to be fully vaccinated. So we saw that those people also get COVID. So you need to make sure that you are fully vaccinated. And then again, what we call the healthcare measurements or the non-pharmaceutical measurements, I think that's very important. We are now being pushed by some of our scientists in South Africa to make away with the masks. The problem is we still hasn't reached a less than 5% infectivity rate. Our schools opened about 2 to 3 weeks ago. It's still too early to abandon mask wearing. So the most important thing, I think, is to make sure that the simple measurements are in place and that we adhere to that. I know people are fed up with being wearing masks and all of that. But in the end of the day, that is what is curbing the spread of the virus. And we have to live with this for still some time to come. For the next 6 months, we still need to see what is going to happen. It's too early to say we're out of the pandemic. It's too early to say we are going to be endemic. Not yet. Still 6 months.
Too early to say that we are out of the pandemic, but since you're talking about vaccination, let's also talk about India's vaccination strategy. Ma'am, we have already surpassed the billion vaccination mark. How do you view India's vaccination program so far?
I think you are doing good so far. It's not easy. It's difficult to get to all the deep rural areas. You've got a vast country like South Africa. We everywhere, doesn't matter where you're, South Africa or India, you will have your anti-vaxxers. Then you will have people that's not really anti-vaxxers, but they are afraid what's going to happen if they take the jab. They're not really convinced at this stage. So they sit on the fence watching and waiting. If we can get these people to be vaccinated, and what India also should do is you need to get, as I've already said, a jab. Especially above the age of 12, because those are the children that like to socialize. We can get jabs in those arms and then boost the jabs into the arms of a certain cohort of people, like your healthcare workers, people above the age of 50, people under the age of 50 with comorbidities, so that we protect those people. So in the end of the day, it goes about what your healthcare system can handle if there's a huge influx of sick people, and trying to protect your population against people who can get COVID and die from it. We're not trying to protect them from mild disease, because mild disease you're supposed to be able to treat at the appropriate level. The problem lies with the severe disease in ICU, not even hospitals, ICU. So if anyone says to me their hospital or there's lots of patients in the hospital, my first question will be, and how many are in ICU and high care? Because that's the numbers that we are worried about. That's the real sick people, not the normal one lying in a normal ward for 3 or 4 days.
But ma'am, as there are concerns about the variants evading the vaccine efficacy, How can the vaccination strategy be dynamic enough to keep pace with the constantly changing virus?
Well, at this stage, the pharmaceutical companies and the researchers need to look at their vaccines. They need to twist the vaccines. They need to preempt that they might be coming, or there might be other variants coming with a lot of mutations that can slip the immune system. But you also need to understand it's not only vaccinated people that get mild disease. We have seen that people who had Delta or Beta before and not vaccinated also got infected. So we need to be balanced in this view. So it means anyone previously either vaccinated or had COVID before, and it's longer than 6 months ago, might be able to get a new, to contract a new variant going forward, especially if the variant escape immune systems, as we have now seen. So unfortunately, this is not only the failure of the vaccines to protect against mild disease, it's your own immune system. So it's all about your immune system. It's about how strong your immune system is. What is your genetically makeup and profile? What is your access to healthcare and a good living conditions? All of that plays a role. It's not only vaccines.
Absolutely, ma'am. But since we're talking about the fatigue from social distancing norms, a lot of us from around the globe would like to ask you this. When can we hope to get rid ourselves of the lockdowns, the masks, the social distancing norms?
That is a difficult question. It depends on who you ask. But for me, I would say for the next 6 months, until we know what is going to happen going forward, I will rather wear my mask to protect you if I'm infected. And if I'm a healthcare worker, I will wear my mask to protect you if I'm infected and I don't know it. And then my mask must be of good quality to also protect me from any viral infection you might spread. So maybe in 6 months from now, when we can have this conversation again, and hopefully there will be good news. But I think people need to start to accept that this virus is not going to go away this easily. The life that we have known is not going to come back within the next 6 months. And we have to just wear the mask. It's not that difficult.
Dr. Coetzee, give us 3 solutions to end this pandemic.
Well, you have to get vaccines to the people. You have to do your non-pharmaceutical interventions, and that also include good sanitation, which is a problem from the government side. Good ventilation, it should be compulsory, and then common sense. And we should keep politicians out of healthcare, to advise us. It should be based on science, but also on clinical experience. We also tend to focus too much on the science and forget that there's a clinical picture and a patient in a room with a normal doctor that you also need to guide and help to get into this pandemic.
All right, Dr. Coetzee, before we end this conversation, your closing thoughts.
I think everyone's tired. Me, myself, is sometimes so tired and don't have the energy anymore to tell patients, please stay out. You're not the patient, only the patient are allowed in the surgery. But you know what? The moment that we get fatigue, that's when the virus is going to come back. And it will come back with a vengeance. If there's a gap, the virus will take it. We haven't overcome the virus yet. So please, I know the fatigue, but we have to be vigilant at least for the next 6 months.
Absolutely, Dr. Coetzee. We know that this is an unprecedented crisis and we can't let our guard down. On that note, thank you so much for joining us and sharing those meaningful insights with us. Thanks a lot, ma'am, and all the best for your future endeavors. Viewers, on that note, it's a wrap on this edition. Thanks for watching and stay tuned to Sansad TV. Namaskar.